that the UP government has now issued an order capping the prices of ambulances. They have now capped the prices of ambulances because people were being looted. And this is the story that Mirror Now brought to you today. And our reporter Alok actually did this investigation by making series of calls and finding out what it is that the ambulance operators are charging us. And Alok's joining me on the phone line with those details. Alok, they have now come up with a cap, 1,000 rupees for first 10 kilometers, and subsequently it increases, and similarly, different for normal ambulance, oxygenated ambulance and ventilated ambulance. But what is it that you had found on ground? Because you just brought out this story today for our viewers, and the Lucknow UP government has now come up with this order. Alok.
See, Tanvi, yes, definitely. It's what we can say that story is impact, because today we ran the story. Yesterday I made several calls on the ambulances to get the ground reality, how much they are charging, and I found out that they were doing overcharging. In fact, today in our report we also said that Uttar Pradesh government has not done any kind of capping despite the direction from the Supreme Court last year. So now finally we can say that Lucknow administration, because we did the story about the Lucknow city particularly, and Lucknow administration has today done the capping. As of now, the order is not to be imposed across the state, but definitely in the coming days, other districts will also adopt it. But as of now, it is specifically for Lucknow, that is the capital city of Uttar Pradesh. And yesterday we did the story, and today we ran the story on Lucknow specifically, how much they are overcharging. So in three categories that they have distributed. One is normal ambulances, 10 for first 10 kilometers 1,000, and the oxygenated ambulances for first 10 kilometers 1,500, and the ventilator ambulances first kilometers that 2,500 will be charged, and later after that 100 rupees subsequently on per kilometer. So this that they have categorized. So definitely it is going to impact on the people, those who are already on stress. We hope that the overcharging that is being done in Lucknow will now stop. Back to you.
All right, Alok, thanks so much for bringing us. So we did the similar story, and Alok had brought it to us for the national capital, where ambulance prices have now been capped. Crackdown has also been initiated on those who are overcharging. We've also now brought this story from Lucknow, where the city administration has now brought in this cap. And Alok is going to keep a close eye to ensure that this is actually followed. And now that the capping has been announced, ambulance operators do not loot people in times of pain and tragedy. Thanks, Alok, for joining us. Good evening once again, and good to have you with us on this edition of the Urban Debate. Tonight, like I promised you a week ago, we bring back the conversation about mental health. Tonight, though, we're going to talk about our frontline workers, our COVID warriors, specifically the medical fraternity. And I want to talk about the big mental health challenge that they are facing. For 14 months now, viewers, 14 months straight, they have worked and fought this pandemic. They have worked long hours. They have overcome their own fear of this disease and this infection when nobody in the world knew anything about it. They have gone to work every single day. They have seen their own colleagues fall prey to the infection. Many of them themselves have been infected, healed, come back. They have lost their peers and their colleagues to the infection. They wear these PPE kits, which are frankly extremely suffocating, and they wear it for 8 hours, 10 hours, 12 hours together. And they work in these hospitals. They hear the cries and the pleas of help every single day. They see people lining up, pleading for some help, an hospital bed, an oxygen cylinder, some plasma from somewhere, a contact for remdesivir, help from the doctor, help from the nurse for every single injection, for every single checkup. They're hounded with phone calls from worried family members who just want to know about their own loved one. And they do this. Our doctors and nurses and the medical staff, they do this every single day. If some of you are those who've been involved in trying to help people around us just in the last 2-3 weeks since things became really bad, and you've been on the phone, sharing contacts, amplifying voices, exchanging information, trying to get somebody a bed, trying to get somebody an oxygen cylinder or a remdesivir drug, and you have felt that exhaustion, you have felt it drain you, you have felt that anger, that disappointment, that anxiety, then imagine what our medical staff has been going through for 14 months now. And we don't even have the time or the space half the time to address their state of mind, to address what it is doing to them, how it plays on their mind, what it does to them to stay away from their families, how do they deal with their anxiety. So we decided we must talk about it, because only then will we be able to do something. Only then will we realize just how difficult it is and create a support system to help them out. So joining me on this conversation tonight, Dr. Harjeet Singh Bhatti, former President of the AIIMS Resident Doctors Association, Dr. Gurpreet Sandhu, President for the Council for Healthcare and Pharma, Vimansa Singh Tanwar, Clinical Psychologist and Head with the Fortis School Mental Health Program, Captain Usha Banerjee, she's the Group Director for Nursing for Apollo Hospitals Group, Dr. Nimesh Desai, Professor of Psychiatry and Director at IHBAS, also joining us this evening. Thank you so much. Let me actually start off with Dr. Gurpreet Sandhu. Dr. Sandhu, we've been speaking about, as a nation, as a world, how the biggest collateral damage of this pandemic is also how it's impacting our mental health. But I think often we forget that the biggest impact will be on our medical fraternity, because you have to tackle these challenges every day.
I think, very well structured program from your side. It's a great initiative. We firstly have to thank the medical fraternity, the nursing teams, the paramedics who are contributing and committing their lives to save our nation. This is a very, very important step. We must all, as a nation and from all communities, thank them for what they are doing to save our nation. This is the first aspect. Okay, getting into the scenario, the most important thing is what they are going through is a very, very difficult phase of life. This community is spending hours and hours of their time in closed environments, stressful areas, foregoing the relationship within their families and getting back into the real frame. Okay. The biggest challenge we are facing today is that what our GDP spend as a nation is just 1.3%, which is far, far low than what the requirements is required. If you look into the regulated regime nations, the healthcare spend of the GDP is around about, say, 14 to 16%. We have miles more to go. There has been a great initiative by Sitaraman this year that the GDP spend by the government has been doubled. But a lot has to be done, and this is what is required. On the other side, the most important thing is the ratio of the doctors versus what is, when you look at the WHO standards, we have a huge gap. We are looking at per 1,000 0.8 versus 4.8 when we look and compare it with markets like Germany, United States of America, Japan, and even when you want to compare it with our neighboring nations. We have a huge paucity of the nursing community. The stress levels come when the same worker, the health committed working team which we have, has to work hours and hours and hours. On the other side, he or she has a lot of mental stigma that their coming home becomes an issue. I think we can talk for as much as possible on this burning subject and respect which this community is giving. So I'll seek your next question and we take it forward.
Absolutely. Let me also bring in our other panelists as well, Dr. Bhatti, to you as well. And if you can just shed some more light on just how challenging the last 1 year and 14 months has been, and how does it play on the minds of, any frontline worker today?
Yes. First of all, we are into this pandemic from last 1 year, and there is if you forget about 2-3 months in between during the period of November, December, and January, most of the time there is lots of patients, and the patients were they were coming with serious infections to the hospitals, and in my experience or to the experience of any of the healthcare workers, we have not seen this type of tragic or crisis in our lifetime. This is our also a first experience where we are seeing so many deaths in hospitals, so many people were dying on roads, people were struggling to get hospital beds, people are struggling to get oxygen, they are managing their patients at home. I have never even imagined that the people are managing their patients at home with oxygen, with injectables, with all sort of treatment which they should have got in the hospitals, but they are forced to do this. So all these things makes us very helpless also sometimes, and it also causes somewhat anxiety or a depression in our mind also, that what sort of healthcare system we have and how we will going to sustain the lives of people if this will goes on increasing. And when we talk about hospital, when we are in the hospital, every moment is a life and death situation. We have to make decision every minute that whom to put on ventilator, whom we can put on oxygen, and if we are giving oxygen, which type of mask we have to use, where we have to place those patients. So it is such an exhaustive process inside the hospital, and what we see outside, that it is definitely causing a very impactful impact on our minds this situation is putting. Apart from that, we all know that duty hours is a very big issue in India's healthcare system. Though central residency scheme says that Indian doctors should work 48 hours per week, but in India doctors were working in India 90 to 120 hours, which is almost double, and it is highest in the world that we are working. And apart from that, half of our colleagues are either infected or they are in isolation or quarantine. So human resources or manpower is very decreasing, duty hours are increasing, and the burden and the expectations from the public and the tragedy which is increasing, all these things are causing a sort of, you can say, impact on the minds of the people. And I can tell you, if you now look at any of the healthcare worker, they definitely being indulged in some sort of unhealthy practices, like either they have a problem of overeating, or they have sleep disturbances, or anxiety, or stress. There is something which is always going on with the healthcare workers, and many people ask us why doctors look so unhealthy, they look fat. But the problem is that they are so much overburdened, so much means burden is put on them that they don't have time to look after themselves, and they are just playing with their own life to save others.
Yes, and you are so absolutely right, about the point that you made about how it impacts you, the bad eating habits, the lack of sleep, or hardly any sleep, which leads to further disorders. All of this then also takes a toll on oneself. Mimantha Singh Tanwar, to you this question then. Do we even as a collective nation recognize this as one of our biggest challenges? How do we address such a problem in the middle of a pandemic, where every medical hand that you can get, you need them on the floor helping and saving people, but we also need to ensure that their mental health is taken care of? So how do we maintain this balance?
I think the first thing that we need to recognize with immense gratitude is the kind of crisis situation that they're managing at this point in time. Like Dr. Bhati said, that these are critical situations where you have to take some of the life's toughest decisions. You have no time to grieve, you're in and out, you're taking these decisions day in, day out, and then there's this fear of going back at home and not giving, this illness passing on to the family, so you're staying away from your family. What we need to really understand at this point in time, as a society, what we can do to come together collectively to ensure that we are somewhere able to break this chain. I think one of the first responsibilities that we have is to stay within our homes no matter what, and continue to be there and practice all the protocols. We've not been able to break this chain because we've not been able to follow the protocols. The second thing that we need to realize is the kind of burnout that doctors are experiencing right now. And what really happens in burnout is that when there is so much physical and emotional exhaustion that till the last mile your coping mechanisms and resources are being used, in fact overused, you tend to become so aloof to your own emotional processes that you have no time to grieve, you have no time to even think of what you are going through. And that's how it begins to also impact your mental health. So yes, doctors have been experiencing helplessness, they have been experiencing anxiety, they have been experiencing features of depression or even hopelessness for that matter. And it is very important that as healthcare workers, as organizations, we have to think about how can we help them provide mental health support. Bringing in the element of self-care, de-stressing themselves while they are at work and even otherwise. We have to really look into how can we help them bring in that balance and care for themselves as well.
Okay, fair enough what you're saying here. Dr. Nimesh Desai, would you like to come in here as well? How do we ensure and take care of our medical, healthcare workers? And of course, one aspect is that we break the chain. We go ahead and get self-disciplined. But the other aspect also is the impact that they've already had. And irrespective of how much the cases come down, their lives are not going to change anytime soon. The influx of COVID and non-COVID patients are going to continue.
Absolutely. Further to what all of my three colleagues said, and really compliments you and the channel for bringing this out on a national platform, because this is a neglected aspect. Care for the carers, not only for core mental health issues like depression, suicide, stress, but also for the link between the physical and mental health issues. And that's really very imperceptible. The first thing, like my colleague said, is to have that deeper sensitivity at the societal and the policy level, government or private or NGO sector. The fact that healthcare professionals and doctors are under stress and yet they are saving lives, almost putting their own lives at risk, is by now so well documented, need not even be said too much. But let me also bring up something else. For last 8 months, we in Delhi have had a nationally available special dedicated helpline for healthcare professionals and frontline workers called Samartha. And believe you me, a bit surprising and not yet so surprising, we have had very little uptake. So there is a finer nuance that I want to bring in here. Let's face it, for valid or not so valid reasons, doctors especially and healthcare professionals, besides the issue of stress and not finding time, also have societal and intra-psychological reasons for not seeking help. Whether that should be so or not is a long-term issue. My point here is that semi-formal mechanisms like even dedicated helplines unfortunately have little uptake. Whereas I have had so many friends, colleagues, juniors reaching out to me. And so what we need to focus on, it seems to me, is informal mechanisms for family, social and the employer support for all the healthcare workers, and at the other end of the spectrum, formal support and mechanisms by the employers, whichever sector they might be in. Let's recognize that for the first time perhaps in post-independent history, we are really seeing the value of medical profession and all the healthcare workers. Let's not miss this chance to seize the opportunity. I don't want to repeat what all my colleagues have said, but this is possibly one opportunity that the society and all concerned have to take care of those who are currently taking care of the society and every human life, literally at the cost of their own lives and peace and taking stress. If we miss this opportunity, I think that would be not only inhuman and unethical, very immoral.
Yes, absolutely. In fact, let me ask you this before I take it to Captain Usha Banerjee. Dr. Desai, is there a policy in place? Should this be a policy that the hospitals have their own in-house platforms and options available, counseling available for their own staff, or should they at least tie up with a third external one? Maybe people are not comfortable talking to somebody in their own hospital, want to go out and do so, but how do we push this to formalize it and to ensure more and more organizations actually take it up?
Yes, very much, Tanvi. I would say briefly that different strokes for different folks. Like you said, some people might feel comfortable expressing their anguish and stress in staff support groups within the organizations. There will be some people who might not feel comfortable individually or in groups to talk about things in one's own organization, and so we need to have other mechanisms outside. We need to have direct and indirect support mechanisms enhancing their morale. The most important part is that sense of recognition, which one must say is happening at this point of time. I'm frankly not too sure how long it's going to last. So the most important part, besides formalizing and offering a variety of options, is to make sure that we sustain the sense of recognition and support for those who are helping the society. The long-term sustenance, to my mind, is the biggest issue, and let's face it, we have as a society, human race in general, and we as a society have not been very good at sustenance issues in such matters.
Yes, we are not. We are not very good in, sustaining a plan, following up with it, taking it to its ultimate point and fruition. We often talk about it and then we forget. Captain Usha Banerjee, thank you for patiently waiting. I want to take this aspect forward with you. About at least to begin with the larger chains, how many of them are actively setting up an environment where their own healthcare workers and their peace of mind is actually taken care of?
Well, Ms. Tanvi, thank you once again for having me up here on this show, and you have set the right context to this entire thing. Thank you so much for that, and all the panelists have had it their bit. I would just like to say that every single healthcare worker understands that they are in the business of life and in the business of emotions. And we have the privilege to celebrate the miracle of birth and, of course, stand in with a prayer and support the dignity of the dying. But we never ever knew that we would be engulfed in this human tragedy. While our profession teaches us to be resilient, today there is a fear of the unknown. There is the sense of impending doom. There is uncertainty. There is vulnerability. There is threat to life, and so much happening around. And healthcare workers are exposed to fake news, rumors, God knows what. And I represent the nurses of the country, and I must say that 24/7 they are battling it out brutally in the lines of the patient's bedside. And I don't think right now anybody is thinking about their psychological well-being. All that we want to do is to save a life. But I'm sure the aftermath will bring in burnout, a lot of stress. There will be cognitive issues that might come up. And I'm glad we are talking about mental health today, and especially about nurses, because they are a young workforce, they have families to tend to. There's so much happening at their social front. I think it is the right time for us to invest in early assessments and in interventions. And I'm glad that many organizations have started to talk about it. There are helplines. We're trying to bring meditation, yoga, fun at work when they're off the work. Many things are in place, but I think as a society we need to rise. We need the doctors to support in with 24/7 counseling sessions, and of course recognize and motivate and build the morale of the workforce, especially the nurses and the other support services who are there at the front line. And I think this is the need of the hour, because this is going to take on as a tsunami after this pandemic slows down a bit.
Yes, in fact, let's talk about some of the kind of impact that is perhaps already visible, and I want to go back to Dr. Bhatti on that. Dr. Bhatti, some of the impact which may be visible, which you may have experienced, or your colleagues and your friends in the same segment have experienced. Take us through that. What goes on, and how does it impact you when you actually have to deal not only with treating the patients, but also you have to handle their distraught families. Sometimes you have to handle their anger, their pressure, their questions, the news of death everywhere around all the time. What are the kind of problems that have now begun to emerge in the medical fraternity because of this?
First of all, I am really seeing a change in the moods of my friends also, in my own mood also, and to whoever who is facing these type of challenges, because it's like if I will talk about previously there was very less chances when we have to break bad or tell the family members about the death of their loved ones or even the critical condition of their loved ones. Now that communication is also became very difficult, means to how to convey the message, and there is so many patients dying, there is so many patients who are ill, and if the patient is young, their family members' emotions was also very high, and so that fear was also inside our mind, though we are not at any fault because it's a natural tragedy which happened, but it becomes very fearful in our mind also, that how to convey the message of their critical loved ones, how to convince them or talk to them and tell them about the reality. So all these situations are coming in front of us every day. And when we talk about our friends, I can say my own friends who are either got infected by the virus, or they are worried about their family members, or they are worried about their patients. So all of them were so much involved into this pandemic that they don't have any time for themselves. Usually now, even if we call to each other, there is no time to talk to each other. Either they were inside the ward wearing PPE, so obviously they are not able to pick up the phone, or if they are at home, they try to talk with their family members. And even the mood was also not so funny or jolly, or the way we talked previously, that mood has also, we are seeing that there is definitely impact is coming on the minds and in the behavior of the healthcare workers, which I am noticing even by myself. So, and these things are, I think, as the process is, as this pandemic is going on, and as the waves are going on increasing, now we are suspecting a third wave also, and the second wave is also causing a very devastating effect. So as the workload is increasing, as the healthcare workers are getting infected more and more, and even we are losing our colleagues or our patients, so this is causing a real impact on the minds. And I think now some concrete actions should be taken. And what I have noticed is there is also a stigma attached to the mental health issues in medical professionals also. And even if you are a doctor, or even if you are a specialist, they were like, sometimes they have a big stigma attached. They don't discuss their problems. And I have faced this issue when I was a president of AIMS RDA at that time. In 2018-19, we have started the helpline number also. And initially there was so much reluctance from medical professionals also to discuss their problems even on phone. They are not ready to take up that issues. So there is definitely a lack of awareness also in the medical professionals. Either they don't recognize the symptoms, or they were not ready to talk about it. So we also have to find out some ways that how we can convince healthcare professionals to talk about their problems and come out and discuss their symptoms so that they can get appropriate treatment.
This is actually very interesting that what you're saying, and let me also bring in Dr. Sandhu on this. Dr. Sandhu, I think, and then I'll come to you, Dr. Nimesh, as well, that I never thought about it, that even within the medical fraternity, Dr. Sandhu, this could play out as a big factor. Stigma can still play on the minds of people.
See, Tanvi, Thank you. That's a great question. To continue what the inputs with Dr. Usha gave, and then our colleagues from the doctor from Dr. Ames. The biggest issue what is being faced is that there is no structure and there is no policy which can give encouragement to the families of the medical fraternity, the nursing community, and the paramedics. Okay, so there has to be a forum or a structure, which should be either brought in with the considering the today's scenario, number one. Number two is that either the insurance sector, has to come with some kind of a module which is backed by the government or by the respective hospitals to ensure that the motivation is there. There is a level of securitization to the families which is delivered, because the medical fraternity is risking its life, facing challenges day in, day out, okay? And then when you are facing death yourself, when you see your patient losing his life or his battle towards life in front of you, leaves a different kind of a scar. And on the other side, fighting against the COVID epidemic, where you don't know if you will sustain yourself and how it can impact on you or your colleagues, okay? So this kind of a mental structure is a very, very difficult call which has to be taken. And yes, the maturity level in bringing the realization to this mental stigma has to be understood at a greater length. If you look into the regulated nations like Japan, United States, okay, the programs which the hospitals, the public sector has taken special initiatives so that the medical fraternity can go share their thoughts, comfort themselves and make sure that their interests are protected, remains confidential. And these are the kind of modules which come up as the healthcare awareness and the healthcare maturity and systems have to be brought into our nation as we build ourselves to the next era going forward.
Yeah, actually that's a very important point that you've made about taking on lessons from what's happening across the world as well. Dr. Nimesh Desai, you wanted to make a point?
A couple of points actually. Like my colleague said, see, doctors and nurses and healthcare professionals actually go through 360-degree stress at any point of time, certainly in this period. There is not even one 10 or 15-degree part of that healthcare professional's existence that's not highly stressed. Seeing people die, worrying about one's own family, worrying about one's own health and outcome, every aspect of it. And so that's a huge issue that I think we need to recognize more and more. Secondly, I really want to entirely endorse what was said about the nursing profession. I mean, not to have pecking order within the healthcare professions, but nurses and all healthcare professionals really deserve, as much as doctors do, that special attention. But the most important point that I want to make, Tanvi, is let's face it, knowledge does not lead to attitude or practice change. Theory believes that better knowledge leads to more positive attitude and more practice change. Now we know it does not. And so, medical profession and healthcare professionals, you would be surprised, many of our viewers might be surprised, actually has a lot of stigma for seeking mental health or psychiatric help. And there is a deeper issue. There is a paradox. And that's really a difficult paradox to deal with, one must say. But we must try. One is the expectation from the society as well as one's own inner ethical values and code of ethics to have resilience to keep working till the last breath. But alongside that set of positive aspects is also the not so great aspect of omnipotence that creeps in. That sense of being God. It may be greatly positive and helpful, but that is what creates another barrier in seeking help. And so my biggest request to healthcare managers, to friends and families of healthcare professionals, to healthcare professionals themselves, is to have that open mind about even the most infallible seeming person being in need of help. Needing help and accepting that one needs help is by no stretch a sense of weakness or fallibility, and it requires strength to accept that one needs help. I'm really glad our young friend, Dr. Bharti, I didn't recognize initially, our young RDF friend from AIMS spoke about that AIMS experience. That's actually a common story, everywhere, including our effort.
Yes.
And so really, we need a larger change to break that paradox.
Yes, you are absolutely right. We need a larger change to break that paradox. Let me now take this across to Mimamsa Singh as well. Mimamsa, so what should be some of these signs that the doctors themselves need to watch out for, where they need to then stop themselves and say, okay, perhaps now this needs some help, we need to reach out for help?
Tanvi, I'm going to add first to what Dr. Desai and Dr. Bharti had said. I think it was a very valid point to still talk about the stigma that prevails mental illness even amongst the doctor fraternity. And what we need to really understand is the education system. We need to talk about mental health and mental illness from the very early on. We need to start from schools. We need to also put this as a part of the education, even during the MBBS years, even during the postgrad years. The conversation needs to start happening a lot more early, so that doctors are able to openly talk about it. If we have to bring about the change in the attitude, then it has to start early. And this is a long-term plan that we are talking about. That we need to start now. We need to start talking about mental health. We need to start talking about mental illness in schools, in the education system very strongly. I think the time for that has come. The second thing that I feel that we need to do is, at this point in time, we need to provide doctors counseling. We need to look at systems where we are able to provide them grief counseling within the healthcare. We need to find a system where we are able to help them recognize what are the signs and symptoms that yes, this is a burnout, and doctors are already experiencing. I mean, these are very visible signs of burnout, where you are, feeling the sense of helplessness. You are feeling the sense of, anxiety, and at the same time, the emotional disconnect with one's own emotional experience as well. That, you work day in and day out. There is a sense of cynicism that can come in your own attitude unknowingly. And this is a sign of burnout, that you're not able to recognize your own emotional experiences. And, in fact, the number of deaths that you're seeing, it almost becomes like a number that you begin to, sort of disconnect with what is happening around you. And that's the only way how you're able to work day in and day out. In a crisis, when you're at war, you don't think, you don't feel, you just work day in and out. And then later on, you realize that yes, it's beginning to impact us. So in fact, how much it is going to impact, what is going to impact, yes, the impact has started happening. It's only after the aftermath we'll be able to actually see the extent of impact that it's actually leading on the doctors.
Yes, and one phrase that you used, I wanted to emphasize on that, Captain Usha Banerjee, it's like you're in a state of war, and when you are in a war, you are not sitting back and thinking, you're processing what you got to do. You have to save lives, and you keep pushing and pushing and pushing and keep moving on. You keep thinking of where you're going to get your next oxygen cylinder from, how you're going to save your next patient, do you have enough drugs, what do you tell the family, how many more people you need to look at, and you go in that entire mode without realizing what it may be doing to yourself and to your mind. And at some point, people will burn out and stop, and it will hit them. Then what? How many organizations are actually right now thinking about then what?
Yes, Ms. Tanvi, I said this right now. We are in the mode of handling the crisis, and for us, nothing is paramount than looking after the patient, their welfare, their safety, their families, their emotional needs, and support in with every single effort that we could, while we grapple with the issues of augmented beds and need for oxygen and everything possible that can support the healthcare infrastructure and make it running. I also say that right now our entire focus is on that, but this is the time when we take the learnings of this situation, and there are a lot of people who are not actively involved into patient care because regular OPDs are not running, theaters are not running to its full scope. There are people out there, back in medical experts, social workers, psychological counselors, who I feel should put in a national program which will help. And I say this especially for nurses. They're not from elite backgrounds. They have small homes. They have small children. They have to go back and do the menial jobs. And I think all kinds of support is required for the nurses. And I'm saying this for the nurses because they form the largest contingent. They work round the clock 24/7. And I think this is the time we have to leverage experts, put in programs. While we do that, and we're doing small things around the healthcare workers in the organizations, I think every single nurse, every single person working under them should be tagged to a counselor who calls them up regularly. We don't wait for the signals of burnout. We don't wait for the impact to come. The aftermath is just staring at us. We need to do something significantly because the pandemic is just not going to end. So doing a few yoga sessions, meditations is not going to help. We'll have to proactively look for symptoms of burnout right now, even if it doesn't manifest. But at the same time, we should be on a preventive mode. And I think there is lots happening around. It's sad to see when a colleague comes down with COVID, it's very painful, and they come back soon. There's no time for rehabilitation. And there is family members affected. We are not able to help people with anything around us at this moment. So I think there is significant amount of work, and I think we have experts in the country who can contribute right there sitting at their homes in order to put in and such kind of modules that help people handle their stressful situations. We could use multiple mediums to do it. It could be short modules on WhatsApp. It could go viral. It could be a Facebook campaign. It could be anything that could benefit us, because I think every single help will matter today. And I need this for the nursing community, definitely across
What could be, yes.
Ms. Tanvi,
Yes.
I would
Dr.
say I
Desai,
have
would you
this
want
fear.
to come in
Sorry.
here and talk about...
Ms. Tanvi, I would like to
Sorry,
say...
go ahead, go ahead, Dr. Usha. Yeah.
Ms. Tanvi, I would say this, that, I am an army trained person. I'm quite resilient. My husband serves the Air Force, and I lead the largest contingent of workforce in the Apollo group. Trust me, I myself have been a COVID victim. Every single day I think, what if I don't pull through? How does my family get taken care of? So if I have that fear, trust me, what happens down to the people, I come back with resilience because that's my job. I need to motivate people, but there is a fear somewhere within. And I'm sure I work for a great organization, the Apollo Group, which talks about all this, and we support in as much as possible. We as nurses huddle up at around 4 p.m. and say a prayer for the entire nation. As small thing as that can be very valuable. So Ms. Tanvi, there's a lot of work to be done in this sphere.
Absolutely, you're absolutely right there, and I think everybody has that fear and anxiety. I know personally few stories. I'm sure you all know so many more of these, of people, doctors, nurses, paramedics, the medical staff, somebody who's been infected twice now with COVID in a year. Twice gotten infected, has had to stay away from the family for pretty much this entire year, has had to stay away from the wife who was pregnant, who gave birth to 2 little girls, has not been able to come spend any time because you need to be at the hospital. And twice being infected, still coming back and still going to work and still saving lives and still, facing this infection every single day. I can't even begin to imagine how the medical fraternity handles this. Preventive measures must be taken, says Captain Usha Banerjee. Dr. Nimesh Desai, any suggestions on what could be those measures that we can look at right now?
Everything that Dr. Usha and the other colleagues said, but let me come back to one of the questions that you had raised. Like I said earlier, not to be seen as a sign of weakness, but as vulnerability. Burnout, let's pick out extreme reactions of apathy or excessive emotional reaction is an indication of burnout. Past history of mental health problems, let there be no shame about it. Like we said earlier, there's a lot of shame, unfortunately, but amongst healthcare professionals, for the person concerned or others around, past history of mental health problems or treatment, biological function disturbance, by any chance disenchantment with life, experience of suicidal thought or ideas. Those are the indicators that we need to pick up. But let me bring in another delicate aspect that's very important for health managers and the society at large. You see, what happens to a young doctor or a healthcare professional, or in fact, a not so young healthcare professional, any one of us, is that the reactions of the family members or people who might die, the reactions and the admonitions of the seniors in the team or the health managers, the comments in the media or the social media, and unfortunately, healthcare professionals or healthcare organizations being dragged to courts of law in these difficult circumstances. We must as a society recognize that while we respect the rights of the media to report everything, while we respect the judicial system, and while we respect the need for discipline, that sensitivity for every healthcare professional in every aspect of his or her existence. You remember that those labels, handle with care, that packages have. I think that's what needs to put on everyone's mind for healthcare professionals. Handle with care.
Yes. You're absolutely right, and thank you for putting that out, because I think people also need to realize, and I wanted to otherwise also touch upon this aspect and ask our doctors as well. Dr. Bhatti, this handle with care, actually he's putting it very mildly, but we have instances in our country where doctors have had to face actual attacks, violent attacks, instances of arson, not just verbal abuse but actually physical abuse. And I was looking at IMA press release that came out just last month, which spoke about how a majority of the healthcare workers have actually faced this themselves. 75% of the doctors, they said, have faced some form of violence. 68% of the violence was committed obviously by the patients' families, their attenders, including phone threats, assault, murder, arson, verbal abuse. There are now instances also, Dr. Bhatti, even in such times, and we make all these grand comments about how we stand with you all and how we back our medical fraternity. But there are instances where even the payments don't come through on time. Doctors and nurses are having to protest to say, please give our pending dues for the past 4 months. Please give our arrears which are pending for the last 1 year. Now, doesn't that add to your burden? How do you tackle that when already you are in a war zone?
Yes, believe me, this is one of the major burden on every healthcare professional, because if any patient lost their life, though we as a doctor, we give our best to save the patient, but even if that patient lost their life, the patient attendance outburst sometimes is so difficult to tackle, and verbal abuse is such a common thing in hospitals that most of the time we don't even report about it. We just take it as a part of our profession and we just cope up with this. It is the physical violence which comes out. Otherwise, this 75% which is given, the data given by IMA, you can even say that 90 to 95% of the doctors are facing some kind of violence or abuse or some kind of discrimination at any moment of time, and this increases our mental burden obviously to an extreme level. And as I already said, that Breaking Bad, like when we have to talk about the patient's critical health or their death, that has become so difficult to talk with the family members, because we know that whenever we talk about them, they just think that it is doctor's fault, because everything comes out to be on the doctor's fault. They don't consider that the hospital have limited infrastructure. They don't consider that oxygen shortage is not in their hand, beds are not in their hand, medications are not in doctor's hand, and whatever limited infrastructure we have, we try to give our best to save the patient's life. But even after that, if something happens, or even if a patient is critical, we tell them to take that patient to some other center where that facility is available. This has causes so much like danger to the doctors, and that they face lots of abuse and sometimes even physical violence also. That's why we are raising this issue from such very long time, that to provide proper security. Even now the court has said that provide proper security to all the hospitals, because we know how people behave when they lose their some loved ones, and this is the words of the court, Supreme High Court. So even the courts knows, judiciary knows, but now I as a doctor, I just only request people to please cooperate with the medical profession, cooperate with your doctors, and we are working day and night. I am telling you that killing ourselves, we try to save others, but we need a strong support from people also.
Absolutely, and one of the initial things that we even saw was this the stigmatization that happened of the entire medical fraternity last year. I wanted to actually also ask you and Dr. Sandhu both if that is still something that our healthcare workers face, from the residential societies where they live, people around them, their neighbors, or at least has that part stopped. Dr. Sandhu?
See, I think it's a very well structured question considering the synopsis which we are discussing. The most important thing is, in a residential structure, the expectation from a doctor is considered next to God. Right? The expectation aspect is so much from the medical profession that the outburst is such that they expect that as long as you are with the doctor, the treatment, the care, life-saving will happen itself. They do not look into the kind of stature, the position and the mental stress which the doctor himself and his family are going through when they are serving. Okay. The other aspect which we just discussed prior to this is that I like to give a very clear and a very structured example. If you look into the medical industry in Singapore, they have private funds and they have the government funding structured in terms of ensuring that if a doctor is getting into a scenario where he loses his life, how his family is taken care of, the financial stress is taken care of. That is a very big motivational aspect which is structured in a lot of countries. If you look into Singapore, you look into Japan, you look into United States of America, France, Germany. Okay, those are the kind of models which have to be built in our system. See, we are miles to grow in the healthcare regime. Okay, if you look into the primary and preventive healthcare, the aspects of motivational theories have to be cultivated. The one more question which I like to leave to the group and convey to yourself, which is the subject which we can debate, right, is that India is being talked as the mental capital of the world. Like we are the diabetic capital of the world today. India, in the next 2 to 3 years, is being talked about around 8 to 9% of Indian population will be mentally affected in one form or the other. And this is a challenge where we do not even have the requisite professional medical teams to cater to. So we have a very large challenge in hand. Yes, the medical community is doing its utmost for the public. It needs applaud, it needs care, it needs, taking care from every angle, and the society in which this community lives has to make sure that they are taken care of. They are understood, their needs are looked into, because this is one of the biggest commitment which this community is giving, to give their own life and save someone's life.
No, you're absolutely right, and I must say that we've constantly had conversations even before the pandemic hit us about mental health, because we believe it's extremely important, and we've actually largely still been at the first step, which is to break the stigma, and which is why our campaign is always called Let's Talk Mental Health, because we need to first start opening up, and then we realize the gravity of just how prevalent it is, just how badly prepared we are for it. And over the past 14 months, this is one thing that has truly, for me and a lot of us here at Mira Now has troubled us, that what is going to be the collateral damage on our mental health because of this pandemic. Everybody talks about the physical aspect of the COVID infection and coronavirus, which we're dealing with every day. And what has just made it worse is what this country is going through today. This country is going through a time where people are literally fighting for oxygen cylinders and praying for one more cylinder, one single drug, vial of injection, one hospital bed, willing to pay an arm and a leg for that hospital bed to save somebody's life. And day in and day out, it is bound to have an impact on us. So we will continue having these conversations. Tonight we wanted to focus specifically on the medical fraternity, because our caregivers also deserve care and need that care. It is essential that we ensure that is given to them so that they can continue doing the work that they are doing. A year or two down the line, we shouldn't be staring at another kind of a pandemic, which would be more to do with mental health. So let's talk now, and let's start looking for options. Let's start helping out people around us right now. Let's act now. Thank you so much for joining us.